What is the typical first-line treatment for hypotension that occurs during the weaning process from cardiopulmonary bypass? A. Intravenous fluid bolus. B. Administration of sodium bicarbonate. C. Increased dose of heparin. D. Use of a vasopressor like norepinephrine. Answer: A. Intravenous fluid bolus. Explanation: hypotension during weaning is commonly treated first with an intravenous fluid bolus to restore intravascular volume and improve venous return. If fluid resuscitation does not correct the hypotension, vasopressors may be used. When weaning from cardiopulmonary bypass, which of the following is most likely to cause arrhythmias? A. Electrolyte imbalance. B. High systemic vascular resistance. C. Low levels of hemoglobin. D. Hypothermia. Answer: A. Electrolyte imbalance. Explanation: electrolyte imbalances, particularly hypokalemia, hypomagnesemia, or hyperkalemia, are common causes of arrhythmias during weaning. Monitoring and correcting electrolyte levels is critical in preventing these disturbances. What is the purpose of gradual weaning from cardiopulmonary bypass, CPB? A. To assess the adequacy of anticoagulation. B. To allow the heart to resume its pumping function. C. To assess the patient's pain level. D. To monitor fluid status. Answer: B. To allow the heart to resume its pumping function. Explanation: gradual weaning from CPB allows the heart time to adapt to the increased workload and resume its normal pumping function. This approach ensures that the heart can handle the hemodynamic demands of circulation after the bypass is removed. Which parameter is typically used to assess the adequacy of myocardial oxygen delivery during weaning from CPB? A. Pulmonary artery wedge pressure. B. Mixed venous oxygen saturation, SVO2. C. Central venous pressure, CVP. D. Cardiac index. Answer: B. Mixed venous oxygen saturation, SVO2. Explanation: mixed venous oxygen saturation, SVO2, is a key parameter used to assess myocardial oxygen delivery and balance between oxygen supply and demand. A low SVO2 suggests that tissues are not receiving adequate oxygen, which could indicate a need for further support. In which situation during weaning from CPB would an intra-aortic balloon pump, IABP, be most beneficial? A. Atrial fibrillation. B. Severe left ventricular dysfunction. C. Aortic dissection. D. Acute kidney injury. Answer: B. Severe left ventricular dysfunction. Explanation: an intra-aortic balloon pump, IABP, is used to support patients with severe left ventricular dysfunction by improving coronary perfusion during diastole and reducing the afterload on the heart. It is particularly beneficial during weaning when the heart is struggling to maintain adequate cardiac output. What is the role of the sigh or manual ventilation during the weaning process from CPB? A. To increase oxygenation. B. To increase CO2 levels in the blood. C. To reduce the risk of air embolism. D. To assess the heart's responsiveness to mechanical ventilation. Answer: A. To increase oxygenation. Explanation: manual ventilation or the sigh maneuver is sometimes used during weaning to improve lung expansion and oxygenation. This is especially important in cases where pulmonary function may be compromised after CPB, and it helps to optimize gas exchange before complete separation. When assessing whether a patient can be weaned from CPB, which of the following is the most important hemodynamic indicator? A. Central venous pressure, CVP. B. Mean arterial pressure, MAP. C. Heart rate. D. Cardiac output. Answer: D. Cardiac output. Explanation: cardiac output is the most important hemodynamic indicator during the weaning process, as it reflects the heart's ability to effectively pump blood and maintain circulation without the support of the CPB machine. A normal cardiac output suggests that the heart can function independently. Which of the following is a typical cause of failure to wean from CPB? A. Low blood glucose levels. B. Left ventricular failure. C. High central venous pressure, CVP. D. Rapid return of myocardial contractility. Answer: B. Left ventricular failure. Explanation: left ventricular failure is one of the most common reasons for failure to wean from CPB. It may occur if the heart is unable to resume normal function after the CPB machine is removed. In such cases, the heart requires additional support, such as inotropic drugs or mechanical circulatory support. What is the main benefit of using a pulmonary artery catheter during the weaning process from CPB? A. To measure cardiac output directly. B. To assess renal function. C. To monitor blood glucose levels. D. To evaluate electrolyte balance. Answer: A. To measure cardiac output directly. Explanation: the pulmonary artery catheter, also known as a Swan-Ganz catheter, is often used during weaning to directly measure cardiac output and other important hemodynamic parameters like pulmonary artery pressure. This helps assess the adequacy of cardiac function and guide treatment decisions. Which of the following is the most important factor in determining the success of weaning from CPB? A. Blood pressure stability. B. Return of myocardial contractility. C. Normalization of blood glucose levels. D. Hemoglobin concentration. Answer: B. Return of myocardial contractility. Explanation: the return of normal myocardial contractility is the most important factor in determining the success of weaning from CPB. If the heart is able to effectively contract and maintain systemic circulation without the assistance of CPB, the weaning process can be considered successful.